Today, we will learn points of the conception vessel. The conception vessel, also named as 任脉, which runs along the anterior midline of the body, has 24 points. Their indications include the brain, nervous system, respiratory, digestive, urinary, and reproductive system problems, and disorders of the running course. CV1 会阴, because it is the intersecting point of the 任, du, and 冲脉, and is between the anus and the external genitalia, it is called 会阴, convergence in. Location, in the perineal region, at the midpoint of the line connecting the anus with the posterior border of the scrotum in males and the posterior commissure of the labial majors in females. This point is not commonly used. CV3, 中极, front move point of the bladder, intersecting point of the 3 foot-in meridians and the 任脉. The point is located at the midpoint of the body and at the end of the trunk. 中 means midpoint. 极 means end, also means utmost. The point is the most important place of vitality, so it is called 中极, middle body point. Location, on the lower abdomen, 4 寸 inferior to the center of the umbilicus, on the anterior midline. Indications: enuresis, difficult urination. Second, seminal emission. Impotence, inguinal hernia. The third, irregular menstruation, flooding and spotting, leukorrhea, prolapse of uterus, vaginal itching, infertility, leukorrhea. Manipulation, acupuncture, needle perpendicularly half to 1 寸 after urination. Local soreness and distension may extend to the external genitalia. Moxibustion can be applied. Precautions. Patients should be asked to urinate completely to avoid damaging the urinary bladder, which can occur if the point is needle deeply. The needle tip should not pierce the parietal peritoneum in order to avoid causing bleeding, inflammation, or a urine leak into the abdominal cavity. The point cannot be used in pregnancy. An 18-year-old man has suffered from enuresis since childhood, every night with 2 to 3 times urination. In winter or cold days, he would have 4 times per night. He was not recovered after various kinds of therapies. There is no physical defect of him, and the degree of his nutrition was normal. Other conditions are as follows: lusterless complexion, light red tongue with thin white coating, deep and thin pulse. Diagnosis should be enuresis, kidney qi deficiency, and bladder out of restraint. Treatment: first, applied reinforcing manipulation after needling at CV3 中极 and spleen 6 三阴交, letting the warm sensation transmitted to his lower abdomen and toes. Then needled GV20 百会 using tonifying method. After the first treatment, he urinated only once at that night. Totally 8 times treatments, he was cured. The patient was followed up for 10 months after treatment, and no recurrence was found. CV4, 关元, front move point of the small intestine, intersecting point of the 3 foot-in meridians and the 任脉. The point is located 3 寸 below the umbilicus. It is the place where original yin and original yang are stored, so it is called 关元, gate of original qi. Location, on the lower abdomen, 3 寸 inferior to the center of the umbilicus, on the anterior median line. Indications: first, difficult urination, frequent urination, nocturnal emission, impotence, irregular menstruation, dysmenorrhea, morbid leukorrhea, sterility, infertility, especially for kidney yang deficiency syndrome. It can help warming, nourishing the kidney, and strengthening yang and essence. The second, abdominal pain, diarrhea, prolapse of the anus. The third, deficiency consumption, manipulation, needle perpendicularly, half to 1 cun after the patient urinates. Moxibustion is applicable. For body strengthening, scarring moxibustion once a year is suggested. The point is contraindicated in pregnancy. This point is the most commonly used point in health care. CV6, 气海, yuan source point of Huang. Its main indication is zang organ deficiency and other prolonged and chronic qi disorders. This area serves as a reservoir of qi for the whole of the body. Where original qi gathers, it is called qi hai, the sea of qi. Location: on the lower abdomen, 1.5 cun inferior to the center of the umbilicus, on the anterior median line. Location method: with the patient supine, the point is at the midpoint between the center of the umbilicus and CV4 guanyuan. Indications: first, collapse due to deficiency, emaciation due to consumptive disease. Second, abdominal pain, diarrhea. Third, difficult urination, enuresis, seminal emission, impotence, inguinal hernia. Fourth, irregular menstruation, leukorrhea, prolapse of the uterus, leukorrhea. Fifth, this is the commonly used point for health-preserving moxibustion. Manipulation: acupuncture, needle perpendicularly 0.8 to 1.2 cun after the patient urinates. Local soreness and distension can be felt. Needle obliquely downward 2 to 3 cun. Local soreness and distension can extend to the external genitalia. For body strengthening, use scarring moxibustion once a year or perform indirect moxibustion using 5 to 14 coins. As stated in clinical cases of famous doctors, 名医类案, a depressive woman with a pale complexion and slim figure gave birth at midnight and fainted at dawn. Dr. Zhu Danxi, a prestigious doctor at that time, first applied moxibustion at CV6 Qihai for 15 zhuang. The woman soon was revived. Then she was given decoction of ginseng, rhizomer attractolus, and other herbal medicines. After 2 months' treatments, she recovered. As a reservoir of qi, CV6 qi hai gathers primordial qi of the whole body. Therefore, using moxibustion treatment on this point can reinforce the vital energy and recuperate the depleted yang. CV8 Shen Que. Que means palace door. The point is located in the center of the umbilicus, where the fetus gets nutrition from the mother and takes on form and spirit. Thus, the region is like the door of the original spirit, and the point is called Shen Que, spirit gate. Location: on the upper abdomen, in the center of the umbilicus. Indications: first, pain around the umbilicus, abdominal distension, borborygmus, diarrhea. Second, edema, difficult urination. Third, wind-stroke collapse syndrome. CV8 can be used in the treatment of diarrhea, pain around the umbilicus, especially cold deficiency type. Manipulation: needling is contraindicated at this point. Moxibustion can be used. Use 5 to 15 coins for corn, ginger, or salt moxibustion, or use a moxa stick for 20 to 30 minutes. CV10 下脘, intersecting point of the 任脉 and the 腹太阴 spleen meridian. 下 means below. 脘 means stomach. The point is located below the stomach, so it is called 下脘, lower stomach. Location, on the upper abdomen, 2 寸 superior to the center of the umbilicus, on the anterior median line. Location method, with the patient supine, the point is at the intersection of the upper 3/4 and the lower 1/4 of a line connecting the xyphosternum, synchondrosus, and CV8 shen que. Indications. First, abdominal fullness and hardness, abdominal lump, poor appetite, emaciation. Second, vomiting even shortly after eating. Manipulation, needle perpendicularly half to 1 寸, or use moxibustion. Precautions, if the needle penetrates the abdominal cavity, it can puncture the opentor majors and the small intestine. In tall and thin patients, the lowest part of the stomach may be level with the iliac crest. Deep needling can penetrate the stomach wall. We should avoid needling the parietal peritoneum. Insert the needle slowly and withdraw it gently. So much for this part. Thank you.